animatedanatomy.com.
Okay, so in this lesson I will be talking about the pelvic floor. And the pelvic floor is made by the pelvic floor muscles. Those are the muscles that we see here. I also added the piriformis right in the left piriformis muscle, and I also added the obturator internus on the right and the left side. These last two muscles, the obturator internus and the piriformis muscle, they create the wall of the pelvis. Just to show you that here behind you have the tendon of the obturator internus. So basically it's coming from the inside, it's the obturator internus. Because of that, it's coming from the inside of the pelvis. However, it's attaching, the tendon is going outside and it is attaching to the femur, just like the piriformis does. Now we can skip to the actual explanation of the pelvic floor and not the pelvic walls anymore. And this here, what we see is the pelvic floor. So to explain you the function of this part of the body, it could take days and days of explaining, so I will keep it short. It is important in providing the support for the pelvic organs like bladder, intestines, and uterus in females. It is important in the maintenance of continence as a part of the urinary and anal sphincters. It facilitates birth by resisting the descent of the presenting part, causing the fetus to rotate forwards to navigate through the pelvic girdle. It helps maintain optimal inter-abdominal pressure as well. Now, the clinical significance here is huge. The pelvic floor, for example, the levator muscle or their supplying nerves can be damaged in a pregnancy or childbirth. It also can be damaged in high-level athletes. The perineal trauma is rare, actually, but it is associated with certain sports like water skiing, bicycle racing. For example, when you sit on a bicycle, it's obvious that you're putting the pressure on this part of the body. So in bicycle racing and similar sports, the perineal trauma can be more often. There are after certain types of surgeries, after pregnancy, the Kegel exercises can be suggested to the patient so that the muscles strengthen or recover. Now, let's get back to the structure. Let's talk about the actual structure of the pelvic floor. The pelvic floor has two hiatuses, meaning gaps. Anteriorly, that is the urogenital hiatus, in which through vagina and urethra are passing, and behind we have the rectal hiatus through which anal canal passes. Now, some sources do not consider pelvic floor and pelvic diaphragm to be identical, with the diaphragm consisting of only the levator ani and the coccygeus, right? While these sources claim that the floor also includes the perineal membrane and deep perineal pouch. This is something I will talk about later, but let's stick to the pelvic floor. Let's stick to these muscles here. The pelvic cavity of the true pelvis has the pelvic floor as its inferior border. So this is the inferior border of the pelvic cavity, okay? This is the pelvic cavity. And the perineum has the pelvic floor as the superior border. So this, when you look at the perineum, the pelvic floor in this case is the superior border. Now let's get back to the actual structure of the pelvic floor. The pelvic floor is created by a levator ani. That muscle is made out of iliococcygeus muscle, the pubococcygeus muscle, and the puborectalis. These muscles make up these fibers make up the levator ani. However, in pelvic floor, we also have the coccygeus muscle on both sides. Now, when we talk about the levator ani, I have to say ani is the English pronunciation for this word. However, in Germany or Austria or Switzerland, we say it differently. So I have to switch to the ani pronunciation. If I said it differently earlier in my videos, you have my sincere apology. Now, the levate or ani is usually considered in three parts. It is the pubococcygeus, the puborectalis, and the iliococcygeus. Here you can see that the puborectalis has these fibers uniting here from the left and the right side, and that way it's creating what's usually very often called the sphincter ani externus. Then this muscle here runs from the pubis all the way back. Well, I wouldn't say that it goes this far. Let's say it goes to here, right? This is not really good illustration. If we remove this, you can see that it goes all the way up, but this is inaccurate. And of course, we have the iliococcygeus, the most posterior part of the levator ani is often poorly developed. This is quite often poorly developed. It starts here at the border of the obturator internus. You can see it right here and there. One thing quite important to mention here is that by weakening the pelvic muscles after the birth, for example, the pubococcygeus muscle can be weakened. It What can happen is the prolapse of the internal organs, for example, through the vagina here. For example, you have the uterus prolapsing through the vagina, and this can be very painful for the patients. They can have sexual dysfunction, and this can be repaired with surgery. Or they can try to do these exercises to strengthen up the muscles in order to slow down the prolapse, because prolapse most often doesn't happen immediately, while it takes some time till the prolapse actually really develops. The muscles that are also important here, for example, those are the bulbous spongiosum and the ischiocavernosus muscle. These muscles are quite important in males as well for the erectile function, and their weakening of these muscles, it can be associated with the sexual dysfunction. This, however, does not count to the pelvic floor. This does count to the pelvic muscles.
Hello everyone, I developed Animated Anatomy that you can purchase on animatedanatomy.com. I put them links down there in the description, or you can click on a link here in a video. If you're not going to purchase my software, then at least make sure you leave a positive comment, subscribe, or like my video.